the event. English and Welsh subtitles are available. There's a button in the bottom of the right-hand side of your screen. Just be aware that sometimes the Welsh subtitles aren't always 100% accurate though. If you have any technical problems, please use the chat to contact the networks team and they'll do their best to resolve it. And your cameras and mics are currently disabled, but we will be enabled when we are taking live questions. So I hope that's all the housekeeping notices. Just really great to see everybody joining, and I'm just going to get the presentation going now. Oh, we are going to be using Slido as well today. Shortly we'll be posting a link in the chat, and hopefully some of you are familiar with using Slido. But basically what you need to do is click on the link or copy it and put it into your phone, and that will take you to a live poll. You can just click directly on the link, it'll take you to the polling, and there'll be a series of questions. And it's just to find out a little bit more about what your thoughts are, your ideas, and what you're hoping, what you're kind of looking for as well. Okay. So let's get sharing our presentation. Okay, is that showing okay, Marie?
Yeah, that's fine.
Great, thank you. I'll just get it into presentation mode. Okay, so just to cover what we're going to be doing today, we are going to be looking at the factors that promote and protect mental well-being and how they can be influenced by different policies. We're going to give examples of how mental wellbeing impact assessment has been applied to different organisational and policy scenarios, and some of the outcomes and benefits that can come from using the tool. We're also going to be talking about some of the skills and tools and knowledge that are needed to use mental wellbeing impact assessment, and more broadly, really make the case for a mental health and wellbeing in all policies approach, and particularly how this fits with the policy context in Wales. So that's the ground that we're going to cover. Before we start on that journey, we're going to do a couple of polls. So Michael, I'd be really grateful if you could put the lovely, thank you, Michael. So you've got the Slido link there. I'm just going to activate the poll, the first poll. So the first poll is all about your kind of current level of knowledge and experience of using, or what do you know about mental wellbeing impact assessment. And I'm hoping that I'm going to be able to bring up the, oh, lovely. Okay, can everybody see the results coming through? Is that showing, Marie? Can you tell me?
Yeah, that's coming through fine. Yeah,
lovely, thank you. So what can we see? We can see that for most people you're very new to the tool. There's some people with some awareness, and some people who have been starting to think about it, and 3% of us have used it in practice, so that's great. But yeah, probably the biggest one group, still a bit of movement there. This is what's so exciting I like about Slido, is it kind of moves around while it's happening. Okay, I think, okay, so most people are completely new, but a bit of growing. Some people have used it in practice. It would be great for those who've used it in practice. I'd love to see in the chat, how you've used it. It'd be really interesting to find out a little bit about how you've used it. So if you would like to share that would be really interesting. Fabulous, thanks. So I'm going to launch the next poll now, which is what sector are you interested in using a mental wellbeing impact assessment? Because I'm imagining most people may have come along today with a particular type of use in mind. So a lot of people are interested in using in health improvement. I'm just kind of scrolling up and down the results there. Can you see the result? Is the results showing now?
Yeah, they are showing. Yeah.
Great, thank you. Okay, so about 60% again interested in using in health improvement. a smaller sort of 10% in research, community development, environment, education, primary care, and anybody for wellbeing plans. I can't quite see that result at the minute. Okay, so that's really interesting. So most of it is in around the kind of promoting health and wellbeing area. Fabulous. Okay, thanks for that. I'm gonna close that down now and just stop sharing a minute and then come back on. We're going to be doing another poll a little bit later, so we will come back to finding out a little bit more about that. Thank you. Okay, so we're going to start really with the what. So I like simple structure. So I'm going to talk about the what, the why, and the how of mental wellbeing impact assessment. And then we're going to come back towards the latter half of the event and hear from Tony about his experience of using the tool in practice. So mental wellbeing impact assessment, it's a health impact assessment tool, and it's used to assess the impact of policies, programs and services on mental wellbeing of different groups of people and on the factors that promote and protect mental wellbeing. And the tool is framed around what we call the 3 core protective factors, which are enhancing control. So this is about how much choice and control people feel they have over their lives and the decisions that affect them. Resilience and community assets. So this is about the resources and environments and relationships that help people stay well, but also thrive in difficult times and recover from adversity, and about facilitating participation and inclusion. So when we're looking about how does something impact on mental wellbeing, we're looking at that through the lens of those protective factors. And we also consider the wider or social determinants of mental health and wellbeing, such as housing, education, economic security, and transport. And we also consider population factors. So what is the existing mental wellbeing of the population affected or involved in a service or project? And what influence might that have on their ability to benefit from the interventional policy? Move my slides on. So a bit of background to the tool. It was developed in the early 2000s. Tony, who's with us today, was the real instigator of mental wellbeing impact assessment, and it was very extensively tested and applied to a really wide range of population groups and settings over in that period up to 2011. And in that time, there were 3 different versions of the toolkit developed, and it's also been used internationally. And Canada actually developed their own guide to MWIA. So lots of different examples. Probably there's about over 1,000 mental wellbeing impact assessments, but there's probably more. Those are just the ones we're aware of. The aim of the tool is really to improve population mental wellbeing and actually promote a consideration and integration of mental wellbeing into all policies, and also to address health inequities in mental health and wellbeing. The process of MWIA can facilitate participation of all stakeholders, including communities and service users, in developing and identifying priorities for action. It identifies both positive impacts on mental wellbeing and negative impacts. And the idea is to basically identify actions that can increase positive impacts and mitigate or prevent negative impacts. It's important to say, and we'll be touching on this when we're discussing the practice later, that whilst it is an impact assessment tool, its application can actually go a lot broader than that. And as is highlighted in the foreword to the toolkit, it is relevant to anyone who wishes to focus or refocus what they're doing to achieve wellbeing outcomes specifically. It's been a recommended tool. So the EU Joint Action on Mental Health and Wellbeing identified a number of tools for mental health in all policies, of which MWIA was one. And it's also been highlighted as part of the Prevention Concordat for Mental Health within the Public Health England guidance. It's a very flexible tool, and we'll be talking a bit more about that later. It can be applied in the design phase of a policy or service, so it can help with the co-design and help that the actual that we're building in prevention at the beginning of a programme, but it can also be used concurrently as a review tool or retrospectively as part of an evaluation of a programme as well. So it's very flexible. It can also be applied to small projects, programs, policies, and it can be undertaken at a different range of depth. So you can do a desktop screening, which might take 2 or 3 hours, or you could do a rapid participatory or a more detailed assessment. We'll be talking a little bit more about the range of tools towards the end. So setting the scene, particularly for those of us working in Wales, where does this tool fit within the sort of policy agenda? Well, some time ago, the Together for Mental Health strategy, which is now kind of drawn to come to the end of its 10-year programme, identified that there was a kind of objective to strengthen how mental health was addressed in health impact assessment. And I put a tick next to that because actually within the Wales HIA support unit, we did integrate a specific section now on mental health and wellbeing into our standard HIA tools, so that that mental health and wellbeing is addressed as part of a HIA. But mental wellbeing impact assessment is a much more detailed framework than can be covered in a general HIA. So if there's an objective of a programme where it's got a particular focus on mental wellbeing, or that the population needs indicate that mental health and wellbeing are really priority outcomes, then mental wellbeing impact assessment on its own may be the right tool if you really want to focus on improving mental wellbeing. And within Public Health Wales's current operational plan, there is a commitment to support the application of mental wellbeing impact assessment now. And we've also committed to developing a Welsh guide to mental wellbeing impact assessment, which we don't have at the moment. There's been limited application of MWIA in Wales to date, so we've got really a lot of opportunity today and over the next year to really think about, what could this tool do for us? How might we want to use it? I'm going to be coming on to talk about the Wellbeing of Future Generations Act in a moment, but I think all of the wellbeing goals are very relevant to improving mental wellbeing, whether it's about cohesive communities or improving prosperous Wales, economic security. So I think we've got a lot of opportunity to use the tool to think about how those wellbeing goals can help us in improving mental wellbeing in Wales. So just to note, really, we're currently scoping the development of a Welsh guide to MWIA, and I hope that the discussion we can have towards the end of this event can help identify those of you who might be interested in being involved in that. Okay, so what's this is a bit about the why, really. Why do we need this tool? What's the problem or opportunity that the tool is kind of aiming to address? So we know that in Wales, as in common with many other countries, mental health problems are one of the largest reasons why people are living with an illness or disability. And you can see in this chart here, we've got these different bars that are showing the various years lived with disability in Wales, and actually mental and substance misuse disorders are the second. The first one is musculoskeletal disorders. So we've got a lot of people experiencing poor mental health, and actually we're very aware that the impact of the COVID-19 pandemic is likely and has probably already started to increase the percentage of people with mental health problems. This chart is by some work from our international health team colleagues. But we also know that having good mental well-being brings many, many benefits, and it's important to focus on that as well as preventing mental health problems. There's many benefits to us promoting better mental health as well, including things like better physical health, healthier lifestyles, more participation, better educational achievement. So we really want to go after this improved mental well-being as well. We know that many factors, and many of us may be familiar with the language of the wider determinants of health or social determinants of health, have an impact on the level of mental well-being in a population. So we've got a chart here that is comparing levels of low mental well-being in areas that have people with material deprivation, which means they don't have enough income or resources to meet their material needs, and those who are not in material deprivation. And you can see that low mental well-being is more than twice the rate in people in households who have material deprivation. And we've begun to work with the WHO in Europe around a framework of the wider determinants of health that's framed around these 5 what's called essential living conditions for healthy lives. And this includes access to healthcare, income security and social protection, the living environment, health and social capital, so things like education, skills, community resources, social relationships, and the health and employment and working conditions. And our colleagues in the International Health Team and Public Health Wales have been doing some really useful analysis looking at, going back to the previous slide, when we look at that gap in low mental well-being between people who experience material deprivation and those who don't, what is it that's causing that gap? Because until we can really pinpoint that, we're really not making enough progress in tackling inequalities in mental well-being. So this chart I've got on the slide here, you can see on the far left side, it's identifying the gap that we looked at in the previous slide, comparing, that sort of 16% of low mental well-being with over 38%. And when they looked at that gap, they found that over half of it wasn't explainable with the current data, but about 44% of it could be explained. And then you can see with that circle with the different color coding, basically about 50% of the explainable gap was linked to inequalities in that social and human capital area. And about 31% of that gap was explained by differences in income security and social protection. And you can also see there's some contribution from employment and working conditions and some from living conditions. The actual contribution of health services to that is really quite small. And that isn't to say that health services aren't important, but when we're looking at trying to improve mental well-being, a lot of this gap that accounts for inequalities is actually explained by wider policy areas. And just going back to those wider policy areas, that's why it's really important that we seek to maximise the opportunities in the social and human capital field, in the employment field, in the living conditions, and in the income security. We really need to be maximising the benefits of those policies for mental well-being, because they make a huge contribution to inequalities in mental well-being at the moment. And that's where we hope that MWIA could make a difference. Just coming on to the Wellbeing of Future Generations Act in Wales, we've had 2 rounds now of wellbeing planning undertaken by public services boards, which are multi-agency boards in Wales that produce a wellbeing plan. And in the review of the first set of wellbeing plans, the Future Generations Commissioner identified that she felt that more thought needed to be given to how communities could foster positive mental well-being, as well as provide additional help for people with mental health problems. And I think her more recent report in 2020 builds on this by saying that we really need to use the wider determinants of health to enable a whole system approach to health and wellness. And again, I would say that mental wellbeing impact assessment has got a role to play in really thinking about how do we create that whole system approach for wellbeing. So that's kind of setting the scene a little bit, really, of the kind of what, in terms of where mental wellbeing impact assessment has come from, why we think it's important and has a role to play in improving population mental health and wellbeing. This next section I'm going to come on to is going to just get into a little bit more detail about the assessment framework, so that you can get a little bit more familiar with some of the factors and some of, when we're assessing a policy, what are we looking at in terms of what its impacts are. So I'm going to come on to that now. So we're going to revisit this summary slide, which identifies the 3 core protective factors, which are enhancing control, building resilience, and facilitating participation and inclusion. I'm just going to have a quick drink. And underneath each of those protective factors, there's actually a much more detailed framework So I'm going to try and orientate you to this table because it is a very detailed table. I appreciate that. And Michael's going to put a link to the checklist into the chat for you, which will provide you with a sort of downloadable version if that's easier for you to look at rather than this slide. So, because I know sometimes slides on Teams can be a bit tricky. So a few things to notice about this table that I want to highlight first is that we're looking at mental well-being from an individual and a community level, because we know that whilst our own kind of individual resources, personality, behaviours influences mental well-being, there's also many influences on mental well-being at that community level as well, and organisational level. And then we also look at it, if you look at that yellow column on the right hand side, we also consider mental well-being and the factors that influence it at a structural level in terms of the wider or social determinants. So it's quite a comprehensive view. Just taking now through each one of the protective factors. So enhancing control, we look at this so when we're conducting an impact assessment, what we're asking is, how might this proposal impact on enhancing control? Will it give people a sense of control? Will it help them maintain independence? How about opportunities to influence decisions? So if, for example, you were developing a new housing estate, are there opportunities for the local community to influence the decisions about the nature of the build or the design or the master plan? Also very important in that one is workplace job control, because we know that having control, a sense of control at work, there's very strong evidence that that is beneficial for your mental well-being. And it also covers things like collective organisation and action and resources for financial control. So people actually being given the help, the skills, the advice so that they can manage their money. We know, obviously, we're now in a cost of living crisis. That protective factor is going to become more and more important to enable people to feel that they can actually manage through this time. Going on to increasing resilience and community assets, again, we're looking at some of the individual levels. So do we think that, for example, I don't know, enhancing a local green space, is that going to improve people's emotional well-being? We also look at things like social skills and cognitive functioning, so ability to understand, think clearly and function socially. So that was an area that I looked at a lot in detail when I was undertaking the mental wellbeing impact assessment, looking at the impact of the pandemic on young people. There's quite a lot of evidence about how lockdown impacted on people's social skills and their concentration, and those factors. Looking at the community and organisational level there, some really important factors there around trust and safety, social networks and relationships, very strong evidence base there about how important they are for mental well-being. And then we look at things like facilitating participation and inclusion, having a valued role. Again, that was something that was really picked up in the COVID mental wellbeing impact assessment, in that children really missed those opportunities to have a valued role at school and take responsibility and have, be involved in pupil voice and things like that. So I'm just trying to give you a little flavour of this assessment framework and the type of impacts and information that can be pulled out of it. Within the impact assessment, we also look at who is impacted. So as well as looking at how people might be impacted, we look at who. And this is where we can really bring a focus on health inequalities and understanding how an interventional policy might impact on different groups, and try to ensure that it doesn't widen inequalities and obviously ideally reduces them. Now, these two elements of the impact assessment are brought together nicely in this diagram, which you can see with mental health and well-being in the middle, with the protective factors, the population characteristics, the social relationships, and then widening out into those wider determinants of health as well. So people differ in how they find interpreting the framework most easy. Some people like a table, some people prefer the circular diagram with mental health and well-being in the middle. But it's all really just providing that framework to help you think through how might what I'm doing impact on mental well-being. What I wanted to do was just bring through some examples of how different policies might utilise, or what might be highlighted from using the framework on different policies. So this is an example of welfare and social protection. So, we can maybe identify that the way that a system of welfare is administered or set up could either enhance control, a sense of control, and it could, try to enhance people's financial control and capability. They might be two areas that a system might impact. They could impact on people's emotional well-being, and I think actually there's quite strong evidence of different ways of accessing income and social protection does impact on those areas. How accessible services and advice are, that's another area. And ultimately, does that income and social protection have a positive or negative impact on people's economic security and access to things like, food and not being in food poverty? Now, I'm not going to go through all these examples because I've just noticed that I'm a little bit over time. So I'm going to move on now to the how of mental wellbeing impact assessment. And this is the front cover of the toolkit, which is a very comprehensive guide to how to undertake a mental wellbeing impact assessment. It's available on the web, and it takes you through a step-by-step process. It's a very detailed guide, and it was published in 2011 by a partnership of organisations in England, and the publication was funded by the Department of Health. So the process of a mental wellbeing impact assessment, if you want to apply the framework to something that you're doing, is very similar to a health impact assessment or other impact assessments, is that you start with a screening, which is initial, and it's like an initial desktop assessment, and that helps you understand, what the potential impacts might be, and would a mental wellbeing impact assessment be a useful thing to do. So it's quite a useful first step because it means you're not diving straight into an impact assessment without considering, is this a good idea? How could we go about it? So the scoping, if you decide to go ahead, is a more detailed phase of kind of planning, what do you particularly want to focus on? What type of methods are you going to use, and who do you want to involve? There's 3 types of evidence used in a mental wellbeing impact assessment, very similar to HIA, which include a community profile, stakeholder evidence. So there's a participatory element and literature review. Now, that is if you're doing a full MWIA. If you were doing a desktop or participatory screening, you might not necessarily collect all of that evidence. The key thing, obviously, is to identify the positive or negative impacts and identify recommendations for how to address them. The other stage that's slightly distinct in MWIA is that from those impacts, you also identify indicators of how you could actually measure the impact going forward. So, basically asking yourself, how would we know if we were having this impact or not? How are we going to measure that going forward? So that's particularly useful if people want to evaluate the eventual impact of their policy or programme. There's a range of MWIA tools available, and this is really what I was highlighting at the beginning, in that there's a very short checklist framework, which is what Michael posted earlier, which is really a kind of very quick way for you to get familiar with the framework. There's a desktop screening assessment, which you can do. Ideally, you would bring together a range of people with a range of knowledge and insight to that process. It shouldn't really be conducted on your own, but that can be completed maybe in 2 or 3 hours, and it can be a really useful process in itself for strengthening a proposal or policy. There's also, if you decide to, if you want a higher level of collaboration and engagement and co-production, you can conduct workshops or focus groups, and there's a full details in the toolkit of how to do that. And you can do a full MWIA where you bring together all forms of evidence to identify impacts, and that would be a comprehensive MWIA. So it is flexible and adaptable, and we're going to talk more with Tony about that later. So how has it been used? Well, I've kind of themed these because some programs are really focused on, we want to measure our outcomes, how are we impacting on mental well-being? And that's why they want to use the toolkit. For other people, they really want to embed mental well-being into their mainstream delivery, and they really want to, it's a more of an improvement focus, how can we improve and enhance our impact on mental well-being? For other programs, it's more about the engagement side. So they actually want to really hear people's views. How are we impacting your mental well-being? How could we improve it? So it's more about co-production. And generally, it's about increasing that understanding of how programmes and policies impact on mental wellbeing. There's lots of applications in lots of sectors. If you're particularly interested in any of these, I can signpost them to you later on. But, you know, education, green space, arts, healthcare, health improvement, workplaces. I can see that somebody's mentioned workplace. It's a very nice published case study in the Journal of Mental Health Promotion, or Journal of Public Mental Health, sorry, on the workplace. So many different applications, but it's all been about really strengthening those impacts on mental well-being. During COVID-19, the toolkit has been really useful for people in the response to COVID-19, thinking about, you know, as it became very clear, the level of concern about mental health and well-being during the pandemic. A number of areas utilised the tool. So in London, there was a borough that used it to inform their community action, to help them identify particular groups at risk, but also key kind of interventions that could help protect mental well-being. A number of people, including Tony, used the tool to help consider how the mental well-being of key public service staff could be protected and promoted. Tony did a piece of work with hotel quarantine staff in Australia. And my own work in the team of the Wales HIA support unit, we've conducted a comprehensive MWIA looking at the impact of the pandemic on young people in Wales. I'm going to take you through very quickly an example in practice so you can sort of see a worked example, and then we're going to come on to have a chat with Tony about his experience of using the tool. So this was a mental wellbeing impact assessment that was conducted with the children's centres, the early years centres in Greenwich in South London. And this was a piece of work that both Anthea Cook and I were involved in. I was involved in the initiation, and then Anthea kind of took over and did a number of mental wellbeing impact assessments with various children's centres in Greenwich. The first children's centre, what they decided to focus on is they wanted to understand how what they were doing was impacting on the mental wellbeing of parents. And this was because mental wellbeing was a priority area in their Healthy Early Years framework. But they really weren't sure, apart from signposting to counselling and mental health services, they really were trying to develop what they were doing a bit wider. They also wanted to engage parents as well in the development of their services. And so they decided to use mental wellbeing impact assessment. Their other interest is that they had to kind of report on their outcomes every year around how they were promoting mental wellbeing. And they felt that mental wellbeing impact assessment would help them develop those indicators, but also the indicators that were tailored particularly for their service. So how did we go about this? So it started with a screening, which was the initial assessment where this was me. I met with the manager, two of the parents, and a family support manager, and we conducted basically an initial assessment. And it helped the people involved in that service get familiar with the framework, so they kind of understood what the assessment was all about. Out of that, it was decided that it would be a good idea to go ahead with the assessment, and we agreed that we would conduct a workshop with parents, but also another session with staff as well to get the staff perspectives. And some further work was done to understand the local population needs in terms of young families and the general literature on how children's centres impacted wellbeing. This led to a variety of actions and the development of some indicators through which they could measure their impact on mental wellbeing on a regular basis. So this table I'm showing now basically summarises what were the priorities when parents were asked how is the children's centre impacting on your mental wellbeing. These are the key themes that they identified that was most important to them. I'm just going to identify a couple. So learning and development was really important. They said actually that the accredited courses really boosted their self-esteem and confidence and helped a lot of them get back into employment. Another really important one was around that sense of belonging and also being valued. They felt that the children's centre was somewhere where they could go that really valued them as a parent. So as a result of the MWIA, the children's centre could identify clearly what was important about what they were doing for parents' mental well-being. Now, I wanted to reflect on this just briefly because I'm running a little bit over time, but standard sort of outcomes measurement tends to sort of take a kind of person A, they have an intervention, which is the arrow, and then you do a kind of outcomes measure. You know, it might be Warwick Edinburgh Mental Wellbeing Scale, it might be another measure of mental well-being, and it's a kind of individualized outcome. But quite often there's a little bit of a question about, well, what happened in the middle to create that outcome? You know, and also what's most important about that, whatever the intervention is, what was most important to people that led to the outcome. So sometimes just the individualized outcome measures don't always answer all those questions. And I think for this case, what the MWIA helped the Children's Centre understand and also get that collective view on is actually what's happening in the middle of those 2 points that we're doing that's important, and what do we need to strengthen and improve to really maximise those outcomes. So out of the end of that MWIA, the Children's Centre decided to increase and promote more accredited courses. They set up a buddying system, and they also had a clear set of wellbeing outcomes to measure as well. So very quick example really, but what was all just to say also kind of that then led to the impact assessment being rolled out across all of the children's centres, so they all had that opportunity to think about it for their own kind of area of Greenwich that they were serving. Okay, I'm going to very quickly touch on outcomes, and then I'm going to move into questions with Tony, and then I think we'll pick up on your questions. I can see there's a few questions coming into the chat bar, and I'm just going to pick on one there because it's quite a simple one. Somebody's asked me, are there any examples of application at a strategy level? The example of answer to that is yes, there are. And quite an early mental wellbeing impact assessment I was involved in was looking at a cultural strategy and what the mental wellbeing impact assessment of that could be. So yes, there are some examples of strategy level. Just to touch briefly on outcomes before I introduce Tony, there have been some kind of review of case studies of mental wellbeing impact assessments that identify some kind of common themes really to what using the tool can achieve. So Anthea Cook and Jude Stansfield did a review of case studies of MWIAs that were applied in lots of different areas, and they generally found that they did help to create better service responses to wellbeing. And one of the factors is that they helped develop a much clearer understanding amongst stakeholders of mental well-being, and actually through that shared understanding they could build whatever it was they were designing or developing in a much more clearer way to have an impact on mental well-being. They do help to ensure that policies and programmes have a positive impact on mental well-being, and that you get that co-production and involvement, and also that they do support local needs assessment and the development of indicators for measuring mental well-being. Another colleague did a review of a number of mental wellbeing impact assessments and actually went back a number of years later to say what difference did it make. And what she found is that there is evidence that the decisions made and the kind of recommendations made from an MWIA are implemented, and that there is some available evidence that led to a measurable difference to people's well-being. But it's very difficult with this type of tool to make a causal link to say, because we use this tool, this is what we achieved. I think that's a very difficult step, and I think it is, there's certainly a lot more scope for us to evaluate the application of that mental wellbeing impact assessment and to follow up on kind of what happens when the tool is utilised. And on that note, I'm going to bring in Tony because this is a topic that we like to talk about, and we're going to have a bit of a conversation basically. So I think if Tony's camera can be put on, if that's all right, please. And I'm going to start. Hi, Tony. Thanks for joining us.
Hi, Nurse.
Sorry, I'm running a little bit late, but I think we'll be fine. We've got a little bit of flexibility in our timing, and then I think we'll have plenty of time for questions. what I wanted to kind of follow on with you from is obviously the last couple of slides I was looking at there, we're talking about the outcomes. So my kind of first question to you is, can you give an example from your experience where MWIA has made a real sort of difference?
Yeah, sure. So I've done a lot of MWAs, and I really do think they make a difference. You talked about, can you make that causal link? How do you know it has an impact? And I suppose there's a few things. The first is sometimes you just don't know. So sometimes you're commissioned to do an impact assessment. You produce a report, you co-produce the recommendations and action plan, you hand it over, and I guess you don't know what happens. Sometimes you are much more involved afterwards. So, for example, someone asked about a workplace example, and you'll probably remember this, Neris, but actually we did quite a comprehensive piece of work with different departments in hospitals across South London. And we worked with teams to really understand what was impacting on staff wellbeing at that particular time. Then we kind of did a thematic review, and we identified stuff that's happening at individual level, at team level, and stuff that was organizational in terms of needing a response. And from that, we developed a strategy and a range of different interventions at different levels, which we called Happier at Work. And that was in 2011. And that program's still running, and thousands of people have been through the program. So so in terms of, can you see the impact that the assessment has had? Yes, I think in that case, you can. And then sometimes you find out by accident. So, for example, a few years ago, I did a piece of work with an inpatient service, a mental health secure unit, and they were concerned that the physical environment was increasing the number of incidents where control and restraint was used, and seclusion, and their aim was to go seclusion free. And this was also in part response to a review of control and restraint. It was in New South Wales, in the state there. So we did an impact assessment there, and we found a whole range of things around the physical environment, but also things that related to the therapeutic environment, which was about how things were done as much as the physical space. Again, action plan co-produced with people who were using the service, staff and carers. And that kind of was the end of my involvement. But about 2 months ago on my LinkedIn, it popped up. This particular unit was celebrating 1 year seclusion free. Now, I can't, can you exactly make those links? But for me, that was a really significant outcome. So yeah. So yes, I think so, but there are some challenges.
Yeah, no, I it's a really good example, and I also remember with the Happier at Work programme that when the staff had a sort of staff-led action plan that came out of the MWIAs, because each team that had the MWIA had a kind of action plan for how they were going to improve mental well-being based on the impact assessment. A number of those were actually about the physical environment in healthcare as well. And I remember, there was kind of a lot of effort put into how can we take those steps. And in a way, some of those try to empower teams to address some of those issues themselves where they could as well.
Yeah, I think so. And for me, that's another outcome. So in terms of the process, is that you are co-producing the stuff and people have some kind of ownership. So I think it's also a really good, it's really helpful in terms of service transformation and things like that, because also you're framing it around the conversation of well-being. So we are serious about your well-being. We know that things that the system is impacting on your well-being, and we'd like to do something about it. And we're going to engage in a conversation, and we're going to ask you, how do we minimize the negative and maximize the positive? So in that way, you certainly find that people have more ownership of it. And certainly I did a piece of work with a public sector service in Queensland where they were returning from remote working. And I think the bit of the process that worked, we identified impacts and particular staff groups and co-produced actions. but the feedback from the manager, it probably was the process of asking people, involving them and getting them to identify what we can do as you're returning to work, that had the biggest, that was the most helpful to them, rather than the changes that we're making. So I think there's different types of impacts.
Yeah, and I think that's really interesting, because when I was giving the different examples of MWIAs earlier, like you say, sometimes it's about the engagement. The engagement process actually is the beneficial part of actually asking people, how is this impacting on your mental well-being? And I know the case study that's in the Journal of Public Mental Health highlights that actually the staff in that case study found the opportunity to share how they were feeling about work through the impact assessment really valuable in itself. So there's something about the process, as well as the kind of actual impacts you identify and the kind of report and actions as well. So yeah, the whole thing can have an impact. Fantastic. So what's your kind of learning through all your experience about how to get the best out of the tools, if you like? Because I've presented that there's kind of a range of tools, there's a range of options. So what do you think's the kind of important thing about getting the most out of it?
I think the ability to adapt it, actually. So there's a kind of central methodology, and I think that remains the same, but it's quite a flexible tool. And I guess COVID has taught us a lot of things, hasn't it? And so, for example, during COVID, we've had to run screenings and workshops online. And we've had to make them shorter, and that has its limitations. So I was doing a piece of work around homelessness. It's really difficult to do online workshops when people are homeless. So you have to think of other ways of doing things. We're doing stuff in regeneration at the moment. What we're finding is that people are finding it more difficult to come to a half-day workshop. So we're having to do shorter stuff online for, say, service providers, and face-to-face with people in communities. But also we're supplementing that with one-to-one interviews. So this sort of gathering evidence from stakeholders, it doesn't, in the toolkit, it talks about running a workshop, but actually I think you can do that in multiple ways. The other thing that we've done is we've integrated it into other health impact assessments, and you talked about that. So, for example, we're doing a piece of work around regeneration in South London and the impacts of potentially regenerating the state on the mental well-being of residents. But we've taken from the Healthy Urban Development Unit some of the housing aspects of that and married it with the mental well-being impact assessment, because we want that kind of focus. So it's adaptable, I think. That's kind of what we're learning. There wasn't one other thing that I as well, is that we've started to do more reflection and feedback sessions. So a session where we'll reflect all the information back to stakeholders, and then we start to do the action planning there. And that's been working really well.
Great, lovely, thank you. Okay, I'm going to move on to actually, there was something you were talking about, your sort of reflections on the process. And I know at the moment you're doing some work with people who are working in Ukraine using the tool, and I just thought it was quite interesting, your reflections on that, about how the tool's been helping them.
Well, it's another example really of so one of the comments, we ran a workshop just going through the determinants of well-being and asking about the impact on their well-being, and I could talk for hours on that, but one of the comments was, they said this felt, is this group therapy? Of course, no, it's not group therapy, it's an impact assessment, but the opportunity just to talk about some of this stuff with colleagues, and also in a way that's very structured, but also looks very broadly at health. They found that really useful.
And one of the things that you talking to me a couple of weeks ago when we were planning this session, that came out of that you said, was actually one of the things they identified was that actually having meetings in their own language, in Ukrainian, would really make them feel kind of, that would benefit their mental well-being.
Yeah, and I think that's a really good. What happens when you do it? Sometimes there's just kind of little things that come out as part of the process that people can do automatically. So, majority of the staff are Ukrainian, but they have people from different nationalities. It's an international program, and all the meetings are conducted in English. But you talk about cognitive functioning, and actually, it's quite tiring talking in a different language all the time. So, one of the things they're doing for certain amount for some of the meetings, they're just talking Ukrainian.
Yeah, and I think that was like a really practical action that came out of it. But I think also for me, sort of living and working in Wales, it really resonated because of how important it is for people to be able to access services in Welsh here, if if Welsh is their first language or primary language, and or their choice, their choice of language, and how actually important that is for their well-being. And it's something, when we've been thinking about a Welsh guide to MWIA, how important actually language and culture is as a protective factor for mental well-being as well. So I just found that sort of really interesting that had come out of that conversation. What do you think the skills and knowledge are that are needed to carry out a mental well-being impact assessment?
Well, to do a full impact, there's kind of range of skills, I think. So you've got data analytical skills because you're doing a community profile. You've got lit search skills and report writing skills, because I'm making sure that reports are accessible for your audience is really important. But you don't have to have all of those. I mean, quite often I work with a team of people and we all bring different skills. So certainly would encourage people to think about, who could be in their team.
And I think that fits very well with within the Wales HIA support unit. We've developed a knowledge and skills framework for health impact assessment, and we've really identified that there's a number of different roles that people can play in an impact assessment, but also different skills. So not one person has to have all of the skills. You might have one person who's a really good facilitator and can facilitate a workshop or conduct interviews, other people who may be more on the data side, who might be able to gather data on the population, somebody else that's, like you say, excellent at writing and pulling it all together. So I think it is very much about not feeling overwhelmed with it and looking at, if this is a tool that you want to apply, what skills have you got in your team to sort of draw on, really.
Sure.
What about kind of level of knowledge about mental health and well-being? Do you think that's an important area?
I actually don't think you have to have that kind of level of knowledge. It's really about facilitating the toolkit, and it's interesting because in some of the sometimes I like to do some background reading, but sometimes it's helpful not to know too much about projects when you're doing them, because you're going in just asking the questions in the toolkit, and it really is the wisdom of the crowd. It comes out from the group of people you've got there. You just really have to ask the questions. That's my personal opinion anyway.
Yeah. And interestingly, building on that, when one of the within the toolkit, we don't actually define mental well-being, do we? Because we actually, as part of the process, we tend to ask people that we're engaging in impact assessment, what does mental well-being mean to you? And actually, that question in itself provides a lot of insights into what factors are influencing people's mental well-being in any situation. And I know I did some analysis, I remember, of a number of different mental wellbeing impact assessments we did as part of the Well London programme, and actually looking at what were the different perspectives on mental wellbeing, and people did bring quite different, whilst there's always some commonality about things that are important to people, you do get a real insight to people by, rather than saying, I'm telling you what mental wellbeing is, I think asking people, hey, what does mental wellbeing mean to you, tends to open up a really good conversation as well.
Yeah, and I can remember we did a piece of work years ago with the traumatic stress unit at the Maudsley, and they had it was asylum seekers coming in, and we did this process where they had to develop their own definition of mental well-being, and it started, mental well-being is leave to remain, and the stuff around, leave to remain food. It's Maslow's hierarchy of needs. Depending on where you are, what you put in your definition, or what you start with your definition is. So you're right. It tells a story. It's interesting in itself. Yeah.
Yeah, and I think that's some of the kind of insights that can come out of the process as well. Have you got any kind of tips for anybody who might want to get started using the tool?
I think so you've got the checklist, and you've got the screening tool. I think as long as you can facilitate a group, the screening tool is a pretty good place to start. And screenings are often really accurate, or usually really accurate, and they're quick. Normally I take about 2.5 hours to facilitate a screening. And I often say to people, if you've got a significant policy or initiative coming up, why wouldn't you take 2.5 hours with a group of 4 or 5 people to kind of figure out what its impact on mental well-being might be and what you might need to pay attention to? So I think there's some easy first steps that people can take, for sure.
Yeah, brilliant. Thanks, Tony. What I thought I'd do is, because I can see there's a few questions coming in on the chat, and I think you might be quite well placed to answer a couple of them. So I'm going to, if you don't mind, I'm going to just quickly, because I can see there's one here, particularly from Imran, about are there any comprehensive mental wellbeing HIA focusing on local housing strategies? Now I know that you've done a lot of work with MWIA on housing. I've done some work with MWIA on housing, but I don't know if any particular, I've got one that I can bring to mind if you want to have a little ponder. So a number of years ago, we did some work with Bristol City Landlord Services, and it was part of their landlord housing transformation. So it wasn't, I suppose it depends what you mean by housing strategy, Imran, but this was really about evaluating the impact of the council as a landlord on the tenants. And just to give you an idea of the process of that, I mean, that involved both workshops with the staff and the tenants to give their perspective on how, I mean, I suppose in a way it was more about housing management than housing strategy. But I know that the tool has been used quite a lot on regeneration, so the development of new housing. And that was really where it originated, didn't it, Tony? Was on some very large scale regeneration within South London.
Yeah, I mean, so as you say, it depends on what you mean by strategy. Certainly, in terms of regeneration programs, and looking at the impact of rebuilding houses, or look at some of the process of that. I've done some stuff around homelessness services and shifting models in homelessness services and the impact of that. And as you say, it started with, and I think it's quite an important point, that the reason that we started to think about mental wellbeing impact assessment, at that time I was working at the South London and Maudsley, was this understanding that regeneration was pouring millions of pounds into areas of South London that was going to impact housing quality, youth provision, a whole range, child centres, a whole range of services that we know that impact people's mental health and well-being. And there's no particular focus on mental well-being, how you maximise it. So that opportunity to shift those things that influence people's mental health before people get into mental health services, it seemed to be a kind of a really obvious place to start working.
Yeah, no, I think that's right. Okay, what I'm going to do is I'm going to open this. I'm just going to spot. I've got one more question here, and then I think I'll open it to if we can take people off mute in a minute, and we can take some questions directly. But I've got another question here. How long usually does it take from the point of screening, scoping, and more wider profiling? Is there any rough time distribution? Yeah, I think this is an interesting one, because I remember when I was working with you, Tony, at South London and Maudsley, we were doing quite a lot of costing of the cost of impact assessments, weren't we? So we were actually trying to drill down quite a lot into how much time does it take for each different element of an MWIA. I mean, it is difficult because there's always adaptability and unpredictability, isn't there, in what happens? So quite often it's not necessarily from one calendar date to another. It's more about how much resource is required. Because I think ideally speaking, an MWIA is linked to a particular decision or development programme. So its timetable is kind of tied to that usually. But I think certainly in terms of a screening, I think, as Tony said, you can really conduct a screening in 2 to 3 hours. Then you probably take you about maybe another half a day or a little bit more to write it up. Then it really does depend how you scope your MWIA for how long it takes. Have you got any rough indication to what you work to at the moment, Tony?
It's really, for me, often what it's been about how your ability to engage with stakeholders and people to make themselves available to you. So
yeah,
you can actually do it fairly quickly if everybody comes to the workshops, but that very rarely happens in terms of getting people's time. So gosh, a real generalization probably would take a couple of months from start to finish, I think, and sometimes much longer depending on that engagement. But the first, as you say, the screening, I'll say to people, I'll come and do it tomorrow, and it'll take a day to write up and half a day to do, so I don't know if that answers the question, but
no, and that wouldn't be sort of 2 months doing it all the time. It would basically be just the fact that it would take that long to maybe arrange some of the interviews or some of the workshops and then get it written up.
So you can't. I guess you're kind of looking at. So if you think a day, 2 days for the screening, with the write up and everything, and then for the workshops, maybe you're going to run 2 workshops, half a day each, preparation, another couple of days, literature review, maybe 4 days, report write. So you're probably talking 10, 12 days, something like that, I'd guess. It depends on the size of it as well. Actually, sometimes you do multiple workshops and you've got multiple stakeholders and interviews. And
I think that's the nature of it being such a flexible tool, is that you can tailor it to different levels of project or different levels of depth of engagement, depending kind of what is wanted from the people who, or from the programme, really. Smashing. Okay, I'm going to open this out. If anybody wants to put their hand up, and if we could take people off mute, please. Does anybody want to come in with another question, please? While I'm waiting to see a hand, I'm just going to answer. Thomas has asked about, has there been any consideration of how MWIAs could support the delivery of a trauma-informed framework for public services? That is such an interesting question, Thomas, and I know there's a lot of work going on around trauma-informed framework, and I actually do think there's some real synergies in, and I've certainly been in conversation with some of my colleagues in the violence prevention unit as well about this, about how some of the protective factors and the framework in MWIA, because it is about promoting and protecting mental well-being, there's a lot of synergy there between a kind of psychologically informed or trauma-informed framework. So I'd love to have that conversation. If you're involved in that, I'd love to carry on that conversation. But I think there is a lot of potential there, definitely. Does anybody else want to come in with a question? Right, I can see somebody's hand. Dave, would you like to come in?
Yeah, thanks, Nerys and Tony. I was just wondering, you talked about synergy between things there. I was just wondering about the relationship and if you had any tips around how we manage doing this and the equality impact assessment as well, which would arguably be a similar application, perhaps some wider stuff, but would also consider, I suppose, people's mental health and well-being and the impact our policies and services have on those. So any tips on how those two things can, I suppose, complement rather than potentially contradict or duplicate would be useful.
Yeah, I'll come in on that, and then Tony, you can come in as well if you want. But actually, one of the few mental wellbeing impact assessments that has been done in Wales was actually a combined EQIA and MWIA, and the reason they did that was because it was about that engagement focus and insight that the MWIA could give to sort of add value to the equalities impact assessment. So actually using the MWIA process gave a lot more insight into how some of the different users of a service, their experience of it and how that had impacted their well-being. So I think the two can be complementary. And actually, what I would say is probably is that the MWIA can add a lot more depth to a equalities impact assessment. And I think it can then avoid duplication. They don't have to be like twin tracks like this. They can kind of do that so that you're not duplicating. Tony, have you got any examples of that at all?
Just agreeing with the piece of work I'm doing at the moment around regeneration. What comes out of the impact assessment will inform the equality impact assessment, and there's just lots and lots of similarities, but I think, as you say, there's probably more depth, and particularly around the mental health elements of it.
Yeah. Okay, great. Anybody else want to come in with a question at all? Keeping my eyes open for hands up. Okay, nobody at the minute.
Can I just an example? One of the things that I think the impact assessment is kind of really thinking about systems. And when I moved to Australia to do something completely different, I went to manage student accommodation because I could manage a bit of the system, and I used mental wellbeing impact assessment to really try and understand what was impacting on the mental health and wellbeing of staff, of students living in the accommodation. And I think when I was employed, they thought I was going to run lots of wellbeing workshops rather than do this type of work. But I think the biggest, you're talking about impacts, I think one of the biggest interventions to support mental health that I introduced, it came from a member of staff. And when I talk to students, you talk about the wider terms of health. Funnily enough, finance is probably one of the biggest impacts for students, particularly living in accommodation and where they can afford the rent. And what happens in that situation is if you miss your first couple of weeks' rent, no one says anything. If you miss the next couple of weeks' rent, no one says anything. And it goes on until you owe thousands of dollars. And then you get an email from the finance department saying, you need to pay this money or we're going to evict you in 10 days. What we ended up doing is going back to the finance department and say, I can cut your debtors significantly. And all you've got to do is, as soon as someone misses one payment, send an email to the accommodation office, and someone from the accommodation office will ring the student and say, see, you've missed your first payment. Are you okay? Is there anything we can do? And for me, that was just a really good example of how the system can really impact, and another part of the system can impact on people's mental health and well-being. And I think one of the nice things about the impact assessment is it roots out some of those things as well.
And I think it can identify some really practical actions as well, because sometimes we feel quite overwhelmed by the kind of fact that a lot of these determinants are quite out of our control, but actually sometimes there are. And I know within health impact assessment as well, we do try to be as practical as possible in those recommendations to say, okay, what can we practically do to improve mental well-being or prevent any harm to mental well-being. So I think that's a really great example. Thank you, Tony. Okay, we've got about 15 minutes left, so Tony, please stay with us, because we're going to I'm just going to talk a little bit about kind of where we're going now with mental well-being impact assessment in Wales, and to try and maybe get a few more comments and thoughts from our audience here. So let me just share this slide, and then we're going to do a couple more polls as well. So I'm hoping, can you see that okay?
Yeah, that's fine.
Thank you. So looking ahead, what we'd really like to kind of think about before the end of the session is, what are there opportunities in Wales with the policy context or particular programmes that are happening now where you think MWIA could make a difference? And I appreciate Thomas's suggestion there about the trauma-informed framework. Could it add value to some existing programmes? I've been in conversation with some of my colleagues involved in the social prescribing work around outcomes framework, and actually could MWIA help inform that? What type of capacity building or training do people think might be needed? If we wanted to see MWIA be used more, what might be some of the challenges? Who could be involved, and who could support with that? Thank you, Jan. I can see an instant idea there around wellbeing plans, and that's really great to see. So if anybody's got, I'd just like to open that out to you really. If anyone's got any comments or thoughts on that, please put your hand up or put something in the chat. We're going to have another little set of polls as well. So maybe while you're thinking about that a little bit, Michael, maybe if you wouldn't mind putting the second set of polls up, please. And I'll just get that. But yeah, really, we want to sort of look ahead really and think about, you know, how can we, our next steps over the next year will be to start thinking about scoping out a new guide for Wales. You know, what do you think needs to be included in that? We've mentioned things like Welsh language and culture, but are there other things? I'm just going to put this next poll, because this is about, you know, what sort of training or support do you think might be needed if we were going to, oh, here we go. I've got 100% on a how-to guide for mental wellbeing impact assessment. So that's definitely something, a bit more understanding of the process. Okay, I'm just watching this move as more people are voting, but thanks for all the votes. It's really interesting to see this. Yeah, that's really helpful. I mean, obviously, as an impact assessment unit, we provide advice to people who want to use health impact assessment. So that's part of our, and we are looking at kind of building our ability to support people with MWIA. But it certainly seems at the minute from your responses to this poll that kind of actually having a guide that's specific, probably for those of us working in Wales, is specific to Wales. And one of the things we try to do in the mental wellbeing impact assessment, looking at the impact of COVID, is make that direct link between mental wellbeing and the national wellbeing indicators. So that would be something we'd be trying to draw out really within a Welsh guide. But that's really useful to know. You know, not a massive interest in training. Nobody wants to do in-person training. But there's, you know, and I think that's to do with accessibility really, but certainly that guide. Okay, that's really helpful. Thanks everybody. I'm going to put up the another question now, which isn't multiple choice, so you can put whatever you like, any ideas. But is anybody on the call interested in being involved in the development of the guide? Oh, sorry, I've got, there we are. That should be, I'm hoping that's showing now, the results coming in. Jan's got a suggestion here. How about a peer group of people or action learning set? That sounds like a great suggestion. Thank you, Jan. I think that is a really good way to go. And I think that's kind of how we did the work in South London, to be honest, was about bringing together small groups of people, either to work as a team to carry out a mental wellbeing impact assessment, or kind of maybe like small groups of people who are all conducting. So we've certainly got experience of doing it in that way. Yes, a few people popping up comments then. So, you know, it's just for me, to be honest, at the moment, this is a little bit just getting a feel for who's interested and what people think might be useful. But people certainly seem to be liking the idea of an action learning set, so that sounds really good. And I think there's, you know, in my experience, there tends to be lots of opportunities to apply the toolkit. Partly because obviously mental wellbeing is a really big priority for a lot of organisations, and in terms of improving population health in Wales. So yes, there's a few offers here. That sounds good. What I would say is, as a follow-up to this event, is if you are somebody who's here today and you're interested, then please do drop me a line. My email's on the slides. So, you know, if that is something you're interested in, do just drop me a line, because I'm beginning to think about how we start to develop the sort of scoping of a Welsh guide, and the way we work as a unit is very much to have a collaborative approach to developing our tools and guides. So because it's really important that they suit the end user. Okay, I've got there's an interesting comment here from Rowena. I do a lot of work in HIA and have experienced pushback from clients around including mental health within the assessment because they consider it too difficult to baseline and to evidence cause and effect. Do you have any advice on this? Well, that's such an interesting one. I wonder what context you're working in, Rowena, whether it's are you working in land use planning? Because I know quite often with things like, development plans and things like that, sometimes people think that there isn't enough evidence or the evidence is too maybe subjective to include in a HIA. But what I would say, thank you.
Sorry, I could turn my mic
on.
That's all
right.
It is in planning. So this particular example is with roads,
right,
and DCO applications.
Yeah. I think it's such an interesting point. And I don't know if Tony, you want to come in on this, but this does get raised with us as a team as well. And I think as our data on population mental wellbeing increases all the time, I think there is less and less reason not to include it because, you can get data on mental wellbeing at quite local levels. Or that will be improving. So I think, and also there's stronger evidence about the impact of different types of development on mental well-being. So even if you can't say for sure that the mental well-being of these specific people in these particular place, what you can say is things like noise, community severance, lack of control, all these things we know do have do have an impact on mental well-being. So I think there is a stronger evidence base. Even air quality now, there's a growing evidence base about the impact on mental health. So my personal view would be that you could challenge that. I don't know if Tony...
well, I did, believe me. National highways are a tricky customer.
Right.
Which is interesting because some of their project, it's not all of them, but it depends on who you're working with. But some I've had a big pushback, and a lot of the impacts of road schemes are mental health related, because it's the stress and anxiety that they might cause the local communities. And I've been told, well, you can't baseline that. You don't know what's going on within those communities right now. And I'm like, well, yeah, but if you have a road built at the end of your garden, you might not have any mental health issues now, but you will. You're likely to. But it's very difficult to put that across.
Thank you for sharing that challenge, because I think it's a really excellent example of why we need to strengthen the consideration of mental health in policies, but also some of the barriers that can be there to actually considering mental health in all policies. So I really appreciate you sharing that. Thanks, Rowena. Okay, I'm aware of the time. I don't want to keep people too late. I just want to bring Tony back in because I want to thank you, Tony, for your contribution to the event. I really appreciate you. Oh, there you are. You're peering back through the virtual mist there. Just want to thank you so much, Tony, for coming and sharing your use of MWIA, your thoughts, how you've applied it, and sharing that experience with us. And thanks for your time.
It's been a pleasure. Thank you.
Yeah, no, thank you so much. And if people have got any follow-up questions after the event, please feel free to drop them in the chat or email me. We'll do our best to follow up to any of the questions we haven't managed to get to. I've got one more poll that I'm going to try and activate now. And this is going to... I need to share the slides, don't I? I need to share the screen. This is going to be about what people have taken away from today. And I'm hoping this is a kind of really magic thing about Slido, is that it creates a word cloud, which is a bit exciting. So let's see if that works. Can you see that coming out?
Yes, that's on screen now.
Oh, lovely. Okay. So a few different some good positive words there. That's nice. Thank you. just to finish up, thank you all for attending today and for all your questions and taking part in the polls. As I mentioned earlier, there is another event coming up around mental wellbeing on the 26th of October. I know my colleagues from the network have put an evaluation form in the chat. We really do appreciate your feedback on the event, because, you know, this is we're starting something new here. We've tried some new things today in the way that we've formatted the events. We'd love to hear what you think about that. And the as we said earlier, the recording will be on the Public Health Network Cymru website as soon as it's ready. Is there anything else I need to say, Marie, before finishing off?
No, I think you've covered everything. Thanks, Nerys.
Thanks, thank you. So yeah, I really hope you've found that useful. And yeah, do get in touch if you'd like to know anything more about mental wellbeing impact assessment. But we've got some nice, useful comments in the word cloud here. So yeah, I hope, you know, that seems very positive. So thank you for that, and have a good rest of the day, everyone. I'm going to draw that to a close now. Thank you. See you soon, Tony. Thank you.